Good morning. Welcome to another edition of the Ministry of Health's virtual media conference, where we bring together subject matter experts to provide updates on COVID-19. Today we welcome back three of our expert panelists. Dr. Avery Hines, Director of the Epidemiology Division of the Ministry of Health, Dr. Joanne Paul, Medical Chief of Staff at the Eric Williams Medical Sciences Complex, and Dr. Neil Bagwandas, nephrologist and acting head of Department of Medicine at the San Fernando General Hospital. I'm Candice Alcantara, Manager of Corporate Communication at the Ministry of Health, and I will moderate this morning's media conference. Dr. Hines, please go now to our clinical update this morning.
Thank you, Ms. Alcantara. Good morning to Dr. Paul and Dr. Bagwandas. Good morning to members of the media, members of the viewing and listening public. The clinical update for the day ended March 12th at 4 p.m. is as follows. As at that date and time, we had conducted 101,519 tests, 53,506 of those in the public sector, the remainder in the private sector, and of those, there were 7,759 positive cases. Of those cases, 7,526 would have recovered, and we have had to date 140 deaths, and we extend our condolences to the members of the bereaved families. There are currently 93 active positive cases distributed as follows. There are 79 in home self-isolation. There are 4 in the hospital, all at the Hoover Medical Multi-Training Facility. There are 4 in step-down at UWI, and there are 6 new positive cases that would have been confirmed from samples received between the 9th and the 11th of March. There are currently 310 individuals in state or state-supervised quarantine. Just to make a quick note, that total of 7,759 cases brings us to 609 positives for this year. Separated as follows: 414 for January, 149 for February, and 46 thus far for the month of March. So while we do see that our cases, the numbers of cases on a daily basis have been going down, we need to continue to be vigilant, as we do still have virus circulating in the country, and there are still positive cases that turn up. So all the measures that we've been emphasizing continue to be of relevance. I turn you back over to Ms. Alcantara.
Thank you very much, Dr. Hines. Today we want to focus on some of the diseases that are in some way aligned to this virus that has changed all of our lives. We go to Dr. Bagwandas, who will discuss non-communicable diseases and their link to COVID-19.
Good morning. I'd like to thank the Ministry of Health for asking me to return to this program today to do a brief update on non-communicable diseases with respect to COVID-19 infection. First slide, please. As we are all aware, and we know by now, most people who become infected with COVID-19 would manifest mild or asymptomatic or possibly moderate disease, in terms of if they may just have a sore throat, muscle pains, feel a bit under the weather. And that constitutes about 81% of people who become COVID positive. 14% of patients, however, may go on to develop severe disease. And by severe disease, these definitions of mild, moderate, and severe, or definitions determined by the CDC and the WHO. So people who become severely unwell would be patients who would require hospitalization, ICU care, mechanical ventilation possibly. These people are very ill and at higher risk of dying. 5% of patients, however, could progress to the critically ill stage, where they have a prolonged illness requiring many days, maybe up to 2 months in an intensive care unit, requiring ventilation, dialysis, because they have multi-organ failure now. Their heart may be affected with poor cardiac function, and this translates into about a 49% mortality rate once you enter a critically ill stage. Now, if COVID-19 infection were allowed to spread without any measures, This 5% of critically ill or 14% severely ill patients would translate into large numbers of ill patients requiring hospitalization and specialist care. And this was clearly revealed in the early stages of the pandemic, where in large developed countries with excellent healthcare systems, their beds and resources were actually severely compromised. So that we read stories about patients having to be treated in ambulances, in different offices, in A&E, critically ill patients. And we even heard terms being used as we have to determine which patients go where. So that this emphasizes the importance of preventing infection and spread of the COVID-19 infection. Slide 2, please. So today, I would just like to briefly reiterate the non-communicable diseases and other risk factors that are associated with severe COVID-19 infection. Having these conditions is not thought to put you at increased risk of getting COVID-19. However, if you do become COVID-19 positive and infected, it places you in a very high-risk category now for getting severe COVID-19 infection, which may progress to being critically ill. And the three most dangerous underlying conditions which have been recognized to be associated with hospitalization for COVID-19 infection are diabetes, hypertension, and obesity. And in fact, in New York, one of their health systems involving 12 hospitals looked at 6,000 sequentially admitted patients to their hospital system who required care for severe COVID-19 infections. And they realized that diabetics constituted 34% of these patients, hypertension constituted 56% of the admitted patients, and 46% of their patients were obese. Now, it is important that to recognize that if your diabetes or hypertension was not correctly or controlled properly, then your risk of getting an even more severe clinical course from COVID-19 would increase. Now, other conditions which predispose you to severe COVID-19 infection would be chronic lung disease, because we all know COVID-19 enters through your nose, goes to your lungs, and the lungs are the first organs usually to become infected, which can become inflamed, progressive respiratory failure. And so people who have underlying lung conditions such as asthmatics, or people who have chronic obstructive pulmonary disease, for example, from smoking, these people are already at risk for lung problems, and so COVID-19 would put them in a higher risk group. Cardiovascular disease such as heart failure, coronary artery disease, cardiomyopathies also are high-risk conditions in terms of becoming severely ill if you have become infected with COVID-19. People with chronic kidney disease and patients on dialysis are at high risk for becoming infected from COVID-19 just because of their underlying medical condition. And because of their condition, they are considered to be immunocompromised to a certain extent, and so at high risk for severe disease. Similarly, patients who have cancer or who are immunocompromised, and by immunocompromised we mean patients whose immune system is not functioning normally. These would be patients who have conditions like connective tissue diseases such as lupus, who require to be on steroids, for example, and other immunosuppressive drugs to keep their diseases at bay. One of the side effects of these medications is that your immune system ability to fight infections is reduced. People of older age, as you get older, your risk for critical disease and becoming severely ill increases. But even healthy patients of any age can become critically ill if you acquire COVID-19 infection. The risk increases with age. Patients who live in long-term care in residential homes or who are in long-term care facilities for health reasons are at higher risk because of their older age and underlying medical conditions. It is important to recognize, though, that it is rare for a patient to have only one condition. For example, a diabetic patient has an 80% risk of becoming hypertensive. So most of our diabetics are being treated for hypertension. An obese person is at high risk of becoming diabetic and hypertensive. Diabetes, hypertension, and obesity now predispose you to developing chronic kidney disease, cardiovascular disease, heart attacks, and strokes. And as you get older, your chance of having all of these comorbidities increases as you get older. So if a patient has more than one of these underlying non-communicable diseases, then the risk of getting severe COVID, severe infection, if you become infected with COVID, increases dramatically. There have been some recent additions, which are not on the slide, of underlying conditions which could predispose you to severe COVID infection. And these conditions are, one, sickle cell disease. And we are aware that our population mix, we have a reasonable prevalence of sickle cell disease and other blood conditions such as thalassemia. Patients with Down's syndrome are now recognized as being in a higher risk category for acquiring and becoming severely infected with COVID infection. Pregnancy is another high-risk category, and smoking. Many reasons because of smoking. Smoking because you could develop chronic obstructive pulmonary disease, because some people share cigarettes, and the mere habit of smoking, you put your hand towards your face, you touch your mouth, could predispose you to infection. Next slide, please. So, as we all know, we need to optimize our health status. If you are diabetic, ensure that your blood sugar is well controlled. Check your blood sugars as daily as you have been told by your healthcare providers. Monitor and check your blood pressure. Take your antihypertensive medications as prescribed. Aim for immaculate blood pressure control. In our setting, as indeed throughout the world, and even in first world countries with well-developed healthcare systems, patients have not been able to go to their healthcare facility for regular checkups for various reasons. One main reason is actually that patients have been afraid to go to their healthcare facilities for fear of acquiring COVID-19 infection. Other situations may be your healthcare facility may have put COVID-19 rules and social distancing measures in place so that getting a face-to-face consult with your healthcare professional may have not have become an easy process. Throughout the world, as in Trinidad and Tobago, telemedicine has been one of our main measures for keeping track of our patients. We are phoning them at home, finding out how they are feeling, inquiring about whether they have gotten their prescriptions, reviewing their blood reports over the phone, and also doing prescriptions and leaving these prescriptions at our healthcare facilities so that they can be collected. Despite these measures, though, a recent survey done in a first world country showed that 1/3 of patients still did not keep their appointments for their healthcare facilities for the reasons I have mentioned. And it is being realized now, almost 1 year into the pandemic, that a lot of diseases, worsening health statuses, heart attacks, strokes, may have taken place along the line, and patients did not see a healthcare professional. So the pandemic has indeed had a deleterious effect in terms of people's healthcare status for these reasons. We would encourage our patients and the population at large to adopt appropriate dietary lifestyles. Losing as little as 5 pounds of weight translates into a more healthy and risk-free individual. Lifestyle interventions, stop smoking, exercise as permitted with our social distancing guidelines, and try to keep as healthy as you could. Now, it has been recognized that 40 to 50% of infections that the population acquire, they actually contract these infections from asymptomatic people or people who are pre-symptomatic, meaning people who have not yet shown, who are infected but have not yet shown any signs or symptoms of COVID-19. Hence the reason to wear your mask, social distance, stay away from high-risk situations. If you have elderly or older relatives at home who have non-communicable diseases, such as those that I have mentioned, such as diabetes, hypertension, cancer, think twice before you leave the home and come back to mix with your relatives. Wear your mask, social distance, and treat yourself as high risk at all times to prevent spread of this scourge. And also, please remember, diabetes and hypertension are the main causes of chronic kidney disease, heart attacks, and strokes throughout the world. So even if COVID-19 is taken out of the equation, these conditions still have to be treated properly and well managed to reduce your risk of heart attacks and stroke. One final thing that I'd like to mention, one more reason why we should aim not to get COVID-19 infection is this term we've been hearing now called long COVID. It has been recognized that even if you have a mild infection with COVID-19, mild, moderate, severe, but even mild, after 3 months of this infection, people are complaining of fatigue, tiredness, heart conditions, inflammation in the heart, and some people are actually disabled to the point where they can't function properly. And this is termed long COVID infection. The etiology and why this happens is not very clear as yet because of the short time, 1 year only. And in fact, in the developing countries, clinics are now being formed to look at these patients to try and help them to get back into their normal routines. So I hope this information I've provided would be helpful and that we will all continue the measures which we have all been doing successfully so far. Thank you.
Thank you very much, Dr. Bhagwan Das. And we go now to another health condition that is linked quite closely to COVID-19. Dr. Paul has been on the program before speaking about COVID-19 and children, but today we've asked her to come back to the program to go more fully into multi-system inflammatory syndrome in children, or MIS-C. We go to Dr. Paul.
Thank you very much, Ms. Alcantara, Dr. Avery Hines, Dr. Neil Bhagwan-Das, members of the media, ladies and gentlemen. I'm just here again. Thank you for having me back. I'm here to discuss two things, actually, MIS-C and also some points about vaccination. So I want to have it where I answer in a question and answer form per se. So the first thing is I deep dive into MIS-C. I mean, we talk about MIS-C all the time, but I want to let us really break it down and understand what we're talking about. So it's MIS-C, and the first word is multi-system. So that means that it must be multiple systems. So in fact, as we know, the systems affected can be brain, heart, lungs, kidneys, bowel, also liver, it could be blood, it could be also the skin. And so when you're looking at it, it must be at least maybe 4 or 5 of those systems affected. So it must be where it's multiple systems. That's the first thing. The second thing is that inflammatory. You know, if you hit your hand, you will see, for instance, it gets inflamed. So what happens is that it gets all bruised, it's all swollen, it's all tender. So imagine all those same organ systems like that, and therefore they can't function properly. So if we think about the most common ones, for instance, the heart. If the heart is inflamed and bruised and swollen and not functioning, therefore you would not be able to push the blood properly. The child will be in shock. They might be a little bit pale. They'll be out of it. The heart might beat faster. Also, the blood vessels in the heart are a little bit more inflamed. So the heart is not as functional. If we look at the skin, when it's all inflamed also, you have the mucous membranes and skin. So you have the eyes being red, the tongue, the lips, and the palms and soles of the feet being also red and swollen and tender, including all the rashes and all the sort of like bruised areas and skin. So therefore you can understand why it's all inflamed, and that's that section of the eye section. In terms of the bowel being inflamed is where it doesn't work properly, so therefore it causes diarrhea because it's not able to absorb the fluid as it goes through, and therefore that's one symptomatology going through there. The other thing might be brain also. If my brain is inflamed, I might be able to process properly, I wouldn't be able to think properly, and therefore the child will be out of it. You'll be asking them, how you doing? They'll be like, So you can tell based on the fact that it's inflamed, it's not functioning properly, it's all swollen and bruised up. And that's the whole thing about the inflammatory section of it. The S stands for syndrome, and syndrome is like a package. It means it all goes together. So it must be multiple systems, they must be inflamed, and it's in one package, and that's why it's called MIS-C in children. Now, if you think about that, think about also how you can really diagnose it. Now, typically, MIS-C happens after the infective period of COVID, so about 4 to 6 weeks after. They're not sure why. We know it's an inflammatory reaction. So therefore, in terms of doing the testing, if it's 4 to 6 weeks after, I may no longer be infected at that point in time as a child. So if you do the COVID PCR swab, you might most likely have it negative and not positive. So in fact, in terms of the numbers we have 29 children right now on our database. It's by Dr. Ronan Ramroop, who is the main person. He is the main child specialist in children. But when we look at that, as the minister had said before, it's actually 21 because it's 21 positive. So we have, out of that list, we have 3 who were COVID PCR positive. That means the swab was positive. But of course it makes sense because it's only done 4 to 6 weeks after the infective period. And then about approximately 18 of those had the antibody test being positive. And thus in terms of COVID test positive, we have about 21 children in that database who were COVID test positive. We thus, if you add up your maths, it's about 8 of them left over who are thus COVID test negative, but they all have the multi-system, so it's multiple systems and it's all inflamed. So it's in terms of that diagnosis, it's a range where we have found worldwide about 30% of the children who have MIS-C have not had anything being positive at all, but we know it's after the fact. In terms of how do we manage the MIS-C, and I know it's a repetitive thing we see all the time, but it's actually really simple. The first thing is prevention. We know that MIS-C happens 4 to 6 weeks afterwards. So the peak of it reflects the peak of the infectivity of COVID. So if the smaller the spike of COVID, the smaller the spike of MIS-C. And in fact, the greater the amount of COVID infections, the more severe MIS-C. So we really want to reduce the amount and also the severity of it. And what to do about that? The easiest things are 3 things we've been mentioning all the time, the 3 W's. Wear your mask, wash your hands, and also watch your distance. Wear your mask, wash your hands, and watch your distance. And this the first start of it in terms of prevention. The second one is what we're doing right now. Trying to make sure that everybody's aware. So you parents out there, grandparents, guardian, by listening to this, you would know what to look out for. And the main things I want you to remember are 5 things. We're looking at fever for about 5 days. If your child been having persistent fever, we're looking at that as the first one. We're looking at the effects on the multi-organ system, as we mentioned before, because it's MIS-C. So the main organs we've seen affected, bowel. So you're going to get diarrhea, skin. You're going to get your rash. You're going to get brain affected and also heart affected. So we're looking at fever, brain effects, heart effects, rash, and also the last one, which is the rash and also the bowel. So look for your 5 things, and you're going to be much more aware of what to look out for. And be demanding. If you find your child looks like it might be MIS-C, when you go to your hospital or to your family doctor or whoever it is right away, tell them, I've seen this on TV and I think my child is maybe possible missy. I want the blood test to be done to look for the other organs that might be affected, maybe kidney and also liver. And even in terms of telling them, can I get my swab being done? Can you do the antibody testing? You take responsibility. This is what we're all about in terms of making sure you're aware, because that's part of the management of missy. And as the minister said last night, he said, let's hit hard and hit early. And so the whole thing we've been doing throughout this entire pandemic on the Trinidad side is trying to make sure we do it very aggressively and we do it early to make sure we protect the population. The third thing is actually what we do in hospital, and that's where the doctors have their responsibility, whether it's a family medicine person or emergency medicine physician or a pediatrician, is to also be aware themselves and to pick up when you present to them to acknowledge that this might be missy and I want to make sure I refer that child right away or I manage that child right away, knowing what to look out for in terms of the organ system involvement. And the fourth thing, we're going back to the third thing, what we do in terms of in hospital, we have been pretty aggressive with it. And I'm thankful for that because we've had 0 deaths in terms of missy. We have the most missy in the Caribbean at the present time. But significantly, as we know, we had our spike August last year. Jamaica is now having their increased cases and Barbados had theirs. So they should look out for a spike in terms of the next 4 to 6 weeks. So maybe as the months go on this year, you might find that they are now having increasing numbers, but we have the most in the Caribbean right now, and we have had 0 deaths from it. But we found that when they come in, we're really aggressive. Our protocol has it where we give steroids. We have something called IVIG, which is where it's all like soups up, so all the inflammatory elements, the end particles, so you have less response and less inflammatory response. We give maybe double dose of antibiotics, aspirin, lots of medications to make that heart beat better. And so we really support it with that child and also give oxygen as required. Out of the list of patients who came through, we've had 3 of them who have been in intensive care, and the rest of them have had moderate illness. The last one we had, case number 29, was just discharged a few days ago. So presently we have nobody in hospital who has missy, and we have on our database with Dr. Ronan Ramrup at least 29 patients. Some of them are COVID associated test positive, and some are COVID negative in terms of testing. In terms of the fourth thing for us to do is the follow-up care. What we do is Dr. Ramrup also makes sure we're doing the heart scan. He does it maybe when they're in hospital every 2 days, and then afterwards it's once a week, then it's once a month, and he watches them for up to a year, and then we'll be able to reassess. And as Dr. Bagwandas mentioned, we know there's an aspect for children also with regards to long COVID. So not only are we watching those with missy for a year in terms of heart, we're also watching the other aspects in our clinic in terms of the multi-organ or multi-system aspects. In terms of the other aspect, vaccinations, persons often ask me 2 main things. One, what we know about the vaccine, AstraZeneca, and when we do get it, we might have some minor side effects such that pain on the site and also mild flu-like symptoms. For the second vaccine with AstraZeneca, will you have more major side effects or milder? And in fact, with the second dose, as you know, we should have our second dose maybe 12 weeks afterwards. The second dose is actually milder. So the first one, you might have some soreness, but for the other one, what they found is that you almost have no side effects whatsoever for the second dose of the AstraZeneca, which is great news for those who are thrilled about having vaccinations. And the other thing to think about, what people often ask me is, should the person take the vaccine if they're fit and healthy and run and do hikes, etc. It's not just about the individual, it's about herd immunity. The more of us taking the vaccine, the more herd immunity we can give. So if, for instance, if I was, which I am, fit and healthy, hopefully, and I've gotten mild symptoms and I have my COVID infection, it only lasts for about 3 to 4 to 6 months in terms of that immune coverage. Afterwards, I can go down. So as we have seen in Italy, they were the first ones to have the increase and upsurge with the pandemic, and now you've seen a second upsurge because they have had it now 6 months afterwards, and their population is a little bit now more vulnerable to it. Again, with the vaccine though, what you find is that it covers your immune system even further. So your immunity is longer and larger. So therefore, with your vaccination, it provides you more coverage. So if we weren't going to get vaccinated, in a few months, we would be back to square one. And I do not want to be back to square one. It means borders, it means schools, back to square one. So I'm saying for not just for you, but for the total country, I recommend highly we take our vaccines to have herd immunity to cover ourselves. But it's not just that. If COVID is going to be here, we must learn from it. And the thing to think about is that not just vaccinate, but healthy lifestyle. I'm talking about exercise, as we mention all the time, making sure you understand about your comorbidities and how to manage it further. We can't have this pandemic happen and not be leave unscathed. We must afterwards grow, and aside from herd immunity, become healthier to provide more protection against the virus in the future, or even a next epidemic or pandemic. So in summary, Missy, we're looking at 5 things for you, the parent or guardian, to remember. Fever for 5 days. Looking at persistent diarrhea. Looking at heart complications, brain complications, and also looking for that rash. 5 things, and you take responsibility, go there and tell your doctor, I think this might be potential Miss C. The second thing to remember is about herd immunity. We want you to take your vaccine and take some responsibility, not just for you as an individual, but for us together in the population. We have to create what we want to see, and the creation is a healthier society that's more protective. And the last thing is a little thing I want us to remember is hold the scene, take your vaccine. I can't sing. If I could sing, I would sing it. But I want us to remember, hold the scene, take your vaccine. Thank you very much. Yeah.
Thank you very much, Dr. Paul. Maybe next time we will get her to sing that slogan for us. And thank you as well for the reminders and for the good news about the special treatment that we are giving to our children with COVID-19. I know that is important for all our medical professionals that we take care of our patients. And I know that members of the public are especially concerned about children, but Dr. Paul has been here and has reassured you that they're getting the best care. And we go now into our question and answer segment. In the usual fashion, please, members of the media, state your name and the media house that you represent before you put forward your questions to our panelists. And in order for us to get the most out of this segment, we have time constraints, and we ask for a maximum of 2 brief questions per media house in the first instance. And of course, if we can, we will come back to you. We begin this morning with questions from AZP News, please.
Hi, good morning. Priya Bihari, azpnews.com. My first question is for Dr. Bhagwandas. Doctor, the 3 major risk factors that you spoke about, diabetes, hypertension, obesity, do you find that they're more prevalent in COVID patients in one part of the country as opposed to another part? And my second question to Dr. Paul. Dr. Paul, why do you think that Miss C, we have more cases here than in any other Caribbean island? Thank you.
I think I heard the question clearly.
Okay, I think what we will do is we will go to Dr. Paul to respond to the second question, and then we will arrange to go to Dr. Bhagwandas. So Dr. Paul, we go to you.
Sure, thank you, Priya. So I think it's a combination. I think early on, we have been really aggressive from the beginning when we had our surge. We had our surge prior even before the other Caribbean islands had theirs. So we were on lockdown, but we had our surge in August and September. So I think it's an earlier surge, but I also think that the pediatricians have been much more aggressive and much more aware. So we haven't been under-diagnosing. We've been picking up really, really quickly. So I think the population has been doing a great job by bringing their children in. I think we've been doing a great job in terms of picking up earlier. But I think it's only temporary. By the end of this year, maybe even halfway through, Jamaica will have increased cases, and so will Bahamas and also Barbados. What I found also is that a lot of there is a genetic predisposition, as I told you before. So it's mostly Afro-Trinidadian children and also mixed children. And this is also the scene that's been showing for the entire of the rest of the world, where it's been the Hispanic element and the black element that's been much more effective with children. So I don't think it's so much a trend. I think we've just been really aggressive with picking up and also with treatment of these children. Thank you.
Thank you very much, Dr. Paul. And going now to Dr. Bagwandas, and just to advise what Mr. Bihari asked, he asked about NCDs, hypertension, diabetes, for example, and those conditions in COVID-19 patients, are they more prevalent in patients in one geographic area than another? All right, so we're going now to Dr. Bagwandas.
Thank you. No, diabetes, hypertension, and obesity pretty much prevalent in most countries in the world now. The last percentage I saw for our population probably would have been 5 years ago. For obesity would have been 32%. So diabetes, hypertension, and obesity are worldwide health issues. And obesity is you can determine if you are obese by you can Google formulae where you input your weight and your height and a number comes up. And if this number is greater than or equal to 30, then you fall into the obese category, which probably a lot of us fall into anyhow. But that just having a BMI greater than or equal to 30 puts you at a 2 times increased risk of being admitted with severe COVID-19 and increases your chance of dying by about 50%. But despite COVID, we should all aim to keep within our ideal body weight because of the risk of becoming diabetic and hypertensive, getting kidney diseases, heart attacks and strokes, etc. if you are obese. It should be a way of life for us to try not to become obese. Thank you.
Thank you very much. And we go now to TTT, please.
Hi, good morning. Sonal Lala from TTT News. Dr. Bagwandas, question for you. I know you gave some general figures in terms of the population as it pertains to how many have hypertension, obesity, diabetes. But in the COVID-19 patients that we've had so far, beginning from March last year, do we have any figures in terms of how many patients would have had diabetes, hypertension, obesity? What was the most we had so far? And to Dr. Paul, have we seen any long-term effects coming out of Miss C so far in the patients we've had?
Thank you very much. We go to Dr. Hines for a response to the first question, and Dr. Bagwandas can add in as well.
Okay, thank you for the question. Now, the information on all 7,000 patients would not necessarily have included levels of obesity, diabetes, hypertension, because the information will then have been picked up by several different institutions at different points and compiled. However, we did note that basically the representation of these conditions in the COVID-19 patients was similar to what we have noted in the general population. And as Dr. Bagwandas had noted, that means that we have a prevalence of general population obesity somewhere around the 30%. The information on a lot of our non-communicable disease risk factor prevalence is actually available and downloadable in what we call that NCD STEPS report. That was a stepwise survey looking at the prevalence of risk factors for the chronic non-communicable diseases, and that's something that can actually be pulled down, and I think we should encourage the population at large to be aware of the prevalence of these risk factors as we try to get people to embrace the healthy lifestyle and embrace the acquisition of knowledge towards that healthy lifestyle. I believe a presentation was done at some point not too long ago on the prevalence of the NCDs across the COVID-19, I think it was the last conference, across the COVID-19 patients. So that is something that we can probably pull back or make sure that we have hosted on the ministry's website for those so interested. I'm going to turn you over to Dr. Bagwandas to respond in further detail.
I have nothing much really to add, except that the last figures I had for diabetes in our population would have been about 12.5%, and hypertension about 21%. But what I would like to say that if your diabetes is well controlled and you contract COVID-19 infection, then your risk of dying is 1%, whereas if your diabetes is poorly controlled, you become COVID infected, then your risk of dying goes up to 11%. And these are figures which have been determined in large countries with good data collection and so on. Hence the reason that you have to control your blood sugar especially properly. And the reason for this is that if your blood sugar goes out of control, then that high sugar, remember diabetes, obesity, and hypertension are all inflammatory situations, inflammatory conditions. And what these conditions do is they suppress your immune system's ability to fight infections such as viruses and bacteria and so on. Thank you.
Thanks for that. I just want to just answer that question. Internationally, they've seen long COVID for about 3 to 6 months with children. And in terms of in Trinidad, we have seen less than international though, but we've seen them where they've had to be followed up with regards to their heart vessels are still inflamed. That's number one. Number two, surprisingly, they have joint pains. So the system gets inflamed, not just the skin and mucous membranes, but the joints also. And so they're not able to walk as well, and they limp for a bit. And so it can last for about a few months. And the last thing is actually brain. Cognitively, they're not able to function as well. So therefore, we have the neurologists involved typically. And so what they do, they follow up because it takes a while to recover and go back to, even if it's online school. So it takes a few months to recover so far for Missy, and it sort of like goes into long COVID. So we have seen some effects so far for the past 3 months, but internationally been seeing at least 6 months this can last for. So as we follow them up, we'll see if they're lasting longer than the 3 months so far. Thank you.
Thank you very much to our panelists. We go now to Newsday for questions, please.
Good morning, Donaldi Susie from Newsday. To Dr. Paul, we've seen some countries, the European countries, suspending AstraZeneca vaccinations or even stopping the campaigns altogether because of concerns of blood clots. What about people who have already had or have predisposed to blood clots? Would you encourage them to get vaccinated as well? And with those who have already been vaccinated, have we seen any further negative effects from the vaccination?
Thank you very much. I think Dr. Hines will take these questions.
Okay, thank you for the questions. One of the things that I'd like to do actually is just to read out that WHO statement on the suspension of the AstraZeneca vaccine in some European countries. And it goes as follows. The WHO is aware that, as a precautionary measure, a few countries in the European Union have suspended the use of a specific batch of AstraZeneca vaccine distributed in the European Union, based on reports of rare blood coagulation disorders in persons who had received the vaccine from that particular batch. Now, this was decided as a precaution whilst the full investigation is finalized. It is important to note that the European Medicines Agency's Pharmacovigilance and Risk Assessment Committee holds the position that the vaccine's benefits continue to outweigh its risks. And as such, the vaccine can continue to be administered even while they're investigating the incidence of these clotting events. The incidence, as they say, of these thromboembolic events, while that is ongoing, the investigation that is, we can still continue to vaccinate. The WHO's Global Advisory Committee on Vaccine Safety systematically reviews any and all of the signals and concerns related to COVID-19 vaccine safety, and this committee meets every 2 weeks, and it meets to advise WHO on the vaccine safety concerns as they arise. And they're currently assessing reports on this. And as soon as WHO has gained a full understanding, then any changes to the current recommendations will be communicated to the public. Now, it's important to note that vaccination against COVID-19 doesn't reduce the risks of other things that people already have as predisposing factors. It will not reduce deaths from other cases, from other causes, and those things will continue to occur even after vaccination, but they are noted to be causally unrelated. So even though you may have an effect immediately after or soon after having a vaccine, it doesn't mean it is caused by the vaccine. So at this point, while we await the further position from WHO, none of the recommendations related to who should be vaccinated will have changed. If a change does occur, then that information and that position change will come from WHO, and we will then assess and make the necessary recommendations at this level. So that's the long answer to a relatively short question. At this point in time, we haven't changed any of the recommendations because there's no scientific evidence to state that we need to change position, but this is being reevaluated by WHO, and as information becomes available, if the position needs to change, we will most certainly bring that information to the attention of the public. I don't know if Dr. Paul has something to add.
Yes, I think we'll go to Dr. Paul for some additional information in response to that question.
Just to say that, just to add to what Dr. Hines was saying, I spoke to Prof. Montai about this, who's our immune specialist in Trinidad, and she said, put into perspective, they've had 50 million persons in the world so far who have had the AstraZeneca vaccine, and they have had some causative effects in a few cases. So we just want to make sure we understand the ratio. It's 50 million who have had no issues so far, aside from minor side effects. So she again is reinforcing that she recommends the vaccine highly for our population at the present time. Thank you.
Thank you very much, Dr. Paul, and for the information from Professor Montai. That really puts things into perspective for us. We go to TV6 now for questions. Not sure if we're having any
Hello, good morning.
Great.
TV6 News.
Good morning.
Good morning. Following up on that issue, I just wonder if Mr. Hines could confirm that we do intend to move forward with the second dose of AstraZeneca vaccines for frontline workers in the interim until that investigation is completed, and if you could state what date that is supposed to commence the second round of vaccinations, please.
Okay, thanks for the question. Short answer is yes. The persons who have already been vaccinated and are on dose 1 of their vaccine schedule will receive the second dose of their vaccines as scheduled. Now, as you would note, since the time frame to elapse between one vaccine and the next is between 8 and 12 weeks, that will vary from individual to individual according to the dose of their first vaccine. So there isn't a single date at which that will begin, but there is a range of dates starting from 8 and ranging to 12 weeks thereafter after the first vaccine. So unless there is some additional information from the WHO in the interim suggesting that there's a reason why we should not continue as planned, the current position, the current scientific evidence, and the current consensus from the WHO is that the vaccination programs as they are currently arranged should continue. Those who have received their vaccines, unless there's some information that arises or some reaction that they as individuals have to the first vaccine, they should receive their second dose of vaccine as scheduled.
Thank you, Dr. Hines. And now a follow-up question from AZP News.
Hi, good morning again, Private Harry. Dr. Hines, you said at the beginning that we had so far for the year 609 cases, 414 in January, 149 in February, and 46 so far for this month. 414 is a large number for January. What do you think had caused that, and now it has been reducing? What therefore are the factors you think that is causing the number of COVID-19 cases in the country to be reducing so much? Thank you.
Okay, thanks for the question. Now, bear in mind that the 414 was in that month when we said or we suspected that some of our social activities during the festive season may have contributed to a temporary rise that we noted. It was a small rise, but it was still a short-lived increasing trend in the middle of January. And that would, to some extent, account for why the January figure was higher than the subsequent month's figures. As we've been saying, the stuff that we've been recommending, the behaviors we've been advocating, and to a large extent the behaviors that the population has been adhering to, would be the cause for the downward trend, even after that upsurge, small as it may have been in January. The continuing use of masks, the continuing contact tracing and quarantine of those who are infected, known to be infected, the continuing adherence to the physical distancing, avoiding gathering, avoiding going into workplaces when you're ill, all of these things continue to provide that level of protection to the population by reducing the risk of infected individuals coming into contact with non-infected ones, with the consequence that the numbers of new cases continue to go down. So it's really important, again, as I think has been echoed by the Minister and by the CMO, to continue to encourage the population to continue to do what it's doing and to congratulate them largely for having adhered in major part to the recommendations so far. If we continue to do this, then we will continue to see the benefits of those behaviors, even as we await the full rollout of the vaccination program.
Thank you very much. And we go to AZP News for a follow-up question, please. Are we ready with AZP News? Okay, I think there may be some issue. So let's go then to TTT, please.
Yes, hi, good morning again. Sunil Lala from TTT. Dr. Hines, I'm just seeking some clarification as it pertains to the public health regulations and restaurants. I know the closing time is 10 p.m. Does that mean that all persons must be out of the restaurants, that is, customers from the restaurants, not exactly staff, but should all customers be gone by then, by that time?
Okay, thanks. Interesting question. If the restaurant is closed, i.e. they've ceased to provide service at 10 p.m., we assume that that would mean that whatever services would have been provided would have been scheduled in such a way that they end at the 10 p.m. time. As you pointed out, that wouldn't necessarily apply to the staff who would stay afterwards for cleanup, etc. But the detailed recommendations on how to apply these regulations have been outlined and discussed with the restaurateurs, etc. I believe that some of these regulations are actually hosted online in terms of the recommendations for operation of the various industries, including the restaurant industry, and we would then rely on those who are running these industries to make all the necessary changes, arrangements, and scheduling to fall within the recommendations, fall within the recommended guidelines for operation.
Thank you very much. And final question this morning from TV6, please.
Hi, Vanessa Cutting again. Dr. Paul, I noted that you indicated that immunity from a vaccine is longer lasting than from the actual virus itself. And I found that to be very interesting. So I was just wondering if you could explain how this could be so, because I'm thinking that the vaccine would be less potent than the actual virus. And also if we could have some information on the immunity coverage period for some of the more popular vaccines.
Hi, thanks for that. So yes, I agree with you, but I think that with this particular COVID virus, what they've shown is that there are two types of immune system setups. So usually we'll have the first one called IgM, which is the antibody itself just goes up and it comes back down after a bit. And we have the IgG, which is a longer lasting one. So for most viruses, especially the coronaviruses like the flu vaccine, remember that's why you have your flu vaccine almost every year, we have limited immunity so to that particular strain. So it goes for a few months, and in fact I think there have been a few cases in US where there was a person who got the COVID vaccine, the COVID infection, and he was actually the helper to the ones who were in ICUs, etc. And when they were checking his immune status, they had to pull him away from those who were infected because they realized it was slowly going down, and his one lasted only for about 4 months. With the vaccine itself, it's like a super booster. So what happens is that it is brought into your system with sort of like a particular additional sort of like a molecule, and what it does, it over exemplifies, it over amplifies everything, so it goes like about 5 times what your immune system can produce by itself, just to make sure you have a response to the vaccination itself. And with that, it can last for about 6 months to a year. Now the proposal is 6 months to a year. As we have seen already with the other strains, we're not sure how they're performing. We have seen that they perform fairly well, but of course, time will tell as the vaccine as the COVID virus mutates further. But so far, with regards to even some of the UK strains and Brazil strains, you've found that the immune response has lasted even over 6 months to 9 months with the vaccine, and they're proposing it can last even up to a year. So we're looking forward to that. In terms of the immune system, it responds higher to the first dose and then the second dose if you have had a 2-dose session. And I'm trying to remember what's the second question, Candace. I know there was a part 2. It was a 2-part question.
I think you got the gist of it, Ms. Cutting. Do you have, you want to give us the second part? Although it's really supposed to be 1. We have 1 minute. Just give us the second part of your question.
Yeah, she covered both parts of the question.
Right, I believe so as well. Thank you very much. We have come to the end of today's media conference. Thank you everyone for participating. Today we spoke about various health conditions that are linked to COVID-19. We looked at NCDs, obesity, hypertension and diabetes, which are quite prevalent in our society, heart disease, and MIS-C, which is multi-system inflammatory syndrome. We looked at MIS-C in children, and hopefully we understand that COVID-19 can have serious implications. So we ask everyone to continue to do all that you've been doing to get us to this stage. As we leave you with a brief video on NCDs from PAHO, we remind you of the 3 W's. Wash your hands, watch your distance from others, and of course, wear your mask.
Cardiovascular diseases, diabetes, cancer, and chronic respiratory diseases are known as non-communicable diseases. In recent years, these diseases have increased as a result of population aging, urbanization, globalization, and changes in lifestyles, and they've become the great epidemic of our age. Non-communicable diseases can largely be prevented by adopting a healthy lifestyle, but to do so requires more than simply personal determination. For example,